Hi everyone, it's Jeremy and David for Phoenix International Stem Cell Clinic. So the question we're answering today, stem cell treatment, is it as good, is it better than placebo, or is it just placebo? It's a great question, David.
So it's a fantastic question simply because placebo is extremely powerful.
Yeah.
And it's funny, because the word placebo just means that you have an effect because the person believes there was an effect, and it means that you're actually seeing, therefore, an effect that has no reasonable explanation outside of the human mind.
Yeah.
Okay. So that means that if we talk about placebo in terms of general practice, where I would see patients sometimes that we say that, antidepressants are known to have a placebo effect. And that means that we can give people, we can bring people in. The act of asking a patient how they are makes them less depressed.
Yeah.
Okay. And the same has been shown then in some of these studies, and we're going to talk about today, where we talk about the placebo effect in things which actually traditionally we would think of as very objective. So especially orthopedics and musculoskeletal medicine, we tend to think that you have a degenerative joint disease whenever you are you've been to X-ray, you have symptoms, you have loss of function, you have pain, and then it's like, this is a classical osteoarthritis, so that's going to need a physical intervention. What's really interesting is we actually have a study here. We're going to link that in the description down below here. But there was a study published in 2017, a meta-analysis of sham surgeries in orthopedics. And that means that they opened patients up, they pretended to operate on them, they didn't do anything else, the patient didn't know which treatment they'd received, and whenever they checked them afterwards, they discovered, and I'm going to read to you word for word what it says here, the conclusion. This review suggests that sham surgery has shown to be just as effective as actual surgery in reducing pain and reducing disability. However, care should be taken to generalise these findings because of the limited number of studies, and that was based on 6 studies, which included 277 patients.
Yeah, and it's really important to say we're not out here throwing stones. Our orthopaedic colleagues are in no way acting unethically. We're not trying to say that. We're just trying to compare apples and apples and oranges and oranges. One of our colleagues that works in a hospital in our area of Norway, one of the first things he'll say to me is surgery is the best placebo. And that is just how it is. But a lot of our patients are asking us, they want really hard proof. If I'm going to spend this much money, I need to know that this is going to work. And so they're comparing to placebo. And this is where it's not as clear cut as we seem. The same we're talking about antidepressants. The same we're talking about just talking to someone is going to change the outcome. So it really makes it a very hard question. Is anything more effective than placebo?
And some things are more effective than placebo. For the record, a lot of the double-blinded randomized controlled trials, that is actually the standard. Absolutely. You have to be better than placebo. But the thing about placebo is that it's effective in maybe 50 to 60% of cases. So if you're getting antidepressants, for example, are considered, now this is a bit of a rule of thumb here, but in general practice, we talk about antidepressants as being around 60% effective. So 6 out of 10 patients will feel an improvement with an antidepressant. 5 of 10, 50% effectiveness is ascribed to placebo. Now that means that the difference there is only the 10%. But of course, if you're a patient and you've been into some consultations with your doctor and you don't feel like you're improving, there is a reason to give these treatments and to try something else. But placebo effect is considered to be around 40 to 60% effective. And actually, one of the other things which is funny about it is that when you ask the question of the patient, that actually changes the outcome as well. So there's people who've studied that as well, how if you ask a patient how they're feeling, they'll feel better. Now, that's maybe not across the board, but a lot of people actually feel better when they receive some attention. And
a little bit conversely, you can also know that that just asking certain questions can have negative connotations afterwards. For example, with prostate surgery, they find that patients that have been told that it's a possibility they'll experience some type of erectile dysfunction or some type of side effects like that actually have a significantly higher rate of having those exact side effects. So placebo in the mind plays an incredibly important role in outcome. But as we're saying, so this goes back to, okay, can you definitively say it's better than placebo? To cut a long story short, does it matter? And of course it does matter, but realistically, as long as the patients are feeling better, that's what we're most focused on. Now, of course, we want to be able to definitively show these things, and that's what we're striving to every day. But with the lack of definitive evidence. The whole point is, does the patient feel better? Well, there's an improvement, okay?
Yeah.
It's not an exact science. We understand it's extremely frustrating for patients when they want to know A plus B equals C, but the human body just in general isn't that easy, okay? So, yes, is this better than placebo? We notice a lot of our patients. So we have an incredibly high success rate, and while we're studying our patients at the moment, as we're saying, we haven't got any better studies to say, is this better than placebo? Because it's unethical for us to try against placebo when patients are paying us for us to do.
And not only that, on the other hand, because this is such a new branch of the research, this is a new field, it's a new medical field where we're learning all the time that there's not enough established data. And that's something that we will only have with time. Well, obviously, until Jeremy and I invent our time machine, we're not able to go forward in time and see the results over a longer period. So that's also part of the limiting factor here, is that we have a problem with the amount of data available, but that problem is not because we don't want to, it's because it's not physically possible to test something over a 5-year period until the thing is at least 5 years old.
Exactly. So, pretty much all health is having the same problem. That there's not enough evidence to definitively say one thing or another. So this isn't a problem that's just isolated to regenerative medicine, to typically very new branches of medicine. This is actually a problem that everyone in all different areas of healthcare have been struggling with, okay? Yeah.
One other thing to mention then, when we discuss the idea of the placebo effect, I want to mention a little bit more of our anecdotal evidence. That's to say, the evidence we've gathered in-house.
Yeah.
And we've been treating people here in our clinic for a long time now with musculoskeletal problems. And an interesting thing as well to talk about is the difference between our treatments and steroid injections, which used to be the mainstay of conservative treatment from doctors. And of course, chiropractors would be doing their manipulations, physiotherapists would be training people up. And what we've discovered there, if we can mention that just for a moment, is that we know that steroid is better than placebo, and we also know from the data that PRP, platelet-rich plasma, and therefore stem cells, as far as we're concerned, although there's no studies doing a head-to-head with that, but we know that a head-to-head study between steroids and PRP show that PRP is as effective or more effective, and also shows that it's effective over time. And this is maybe where I think actually we're going to see the difference between placebo and this, is that a placebo effect tends to fade with time, whereas an effect like this, a regenerative effect, ought to improve over time. So hopefully in the future we'll be seeing more and more data that supports this, but at the minute the early data is very, very promising and very positive. But like Jeremy says, we have no randomized controlled, placebo-controlled trials that we can really point to, because at the minute they just don't exist. So we'll keep you informed. We're always looking up the data. We're always reading the research and keeping ourselves abreast of the newest things that come out here. And obviously, we want to hear from you. So if you have knee or joint problems, back problems, let us know. We're really interested in seeing patients who've either been told that they're too young or they're too healthy for a surgical intervention, because those people have had really good results with us in our in-house testing, like we say.
Exactly right. And you don't need to come to Norway for us to do this. We've got we do telephone and we do video consultations with our patients all around the world. And so, we really also want to do videos that you guys want to see. So if you really want to see a video, you want us to answer questions, just comment it below, and we're going to do our absolute best to answer that as fast as we can, okay? In the meantime, have a great day.
See ya.